According to Philstar.com, on its article posted last February 4, 2020, authored by Ms. Sheila Crisostomo. The Philippines' suspected novel coronavirus patients jumped to 80. The 66 others have been advised to undergo home quarantine for 14 days by the Department of Health. Manila, Philippines. The number of individuals in the country being monitored for possible novel coronavirus acute respiratory disease 2019 NCOV-ARD more than doubled overnight to 80 people as of yesterday from only 36 on Sunday. The figure included 8 individuals believed to have had close contact with the first NCOV fatality in the Philippines. The 8 have been placed under quarantine. They were part of the 74 who may have come into contact with the victim, a 43-year-old Chinese tourist from Wuhan in China's Hubei province. The 66 others have been advised to undergo home quarantine for 14 days by the Department of Health. Department of Health Epidemiology Bureau Director Ferchito Avellino said at a press conference they were able to identify the 8 people under investigation from among the close contacts of the fatality and his partner. They are 4 hotel staff and 4 passengers, he said. The couple arrived in Cebu on January 21 on Cebu Pacific Flight 5J241 via Hong Kong and went to Dumaguete on Cebgo Flight DG6519 the next day. They then took a Philippine Airlines flight to Manila. The 2 were brought to San Lazaro Hospital as the woman had a cough while the man was manifesting fever. Avellino stressed it is extremely important for close contacts to come forward and inform a health provider so they can be given appropriate management. The first fatality in the Philippines, and outside China, was the 43-year-old male tourist who succumbed to severe pneumonia. His 38-year-old partner was the first case of NCOV infection recorded in the Philippines. Health Secretary Francisco Duque III noted that substantial increase in the number of people under investigation largely due to strengthened surveillance system and contact tracing being done by the Epidemiology Bureau. Duque also attributed the increase to the expansion of the coverage of the term people under investigation to include not only people from Wuhan but travelers from the entire province of Hubei as well. We have also expanded the people under investigation category coverage to the whole of China, following the recent imposition of travel ban to mainland China, including Hong Kong and Macau, he said. He also emphasized there is still no local transmission of NCOV in the Philippines. It is very clear and I categorically state that the 2 cases are imported cases and that statistics are for China. For us, it is zero local transmission, he added. Cases breakdown. Department of Health data show there are now 80 persons under investigation in the country, 67 of whom are currently in isolation. 10 others have been discharged under strict monitoring. Included in the 80 cases are the couple and the Chinese man who tested negative for NCOV but died of pneumonia. Data also stated that 27 of the 80 cases came from Metro Manila, 15 from Central Luzon, 11 from Central Visayas, 8 from Western Visayas, 5 each from Northern Mindanao and Davao, 4 from Southwestern Luzon Islands and Palawan, and 1 each from Cagayan Valley, Ilocos and Eastern Visayas. According to Department of Health Undersecretary Eric Domingo, the country's first NCOV fatality did not have underlying condition, but he was found positive for a mix of bacteria and virus. It was Domingo who revealed that person under investigation numbered 36 as of Sunday. He said only the samples collected from the woman were submitted to a laboratory in Melbourne, Australia because results of the preliminary tests done on her at the Research Institute for Tropical Medicine were suggestive of NCOV. We only had 6 slots for the laboratory in Australia so we added the specimens taken from the women. She had the bigger chance of turning positive for the virus, he maintained. The man's samples were examined at the Research Institute for Tropical Medicine in Tarlac City. Mayor Christy Angeles said 5 Chinese missionaries and a Filipino have been confined at the Tarlac Provincial Hospital Her quarantine is persons under investigation. She appealed to her constituents to please stay calm and do not panic, as she cited the need to confine the 5 foreigners and the Filipino initially in Jackson's Medical Center for cough and fever and later at the Tarlac Provincial Hospital. It was not clear if the 6 were among the person under investigation on the Department of Health's record. An advisory from the Tarlac city government said the 6 showed signs symptomatic for coronavirus, prompting health authorities to have them quarantined, citing record of their flight layover in Hong Kong. Specimens were taken for testing to check if positive or negative, Angeles said. City Health Officer Dr. Carmela Go has been coordinating with the provincial epidemiologist and surveillance unit, according to the advisory. Meanwhile, the Department of the Interior and local government, upon Department of Health's request, has ordered the police to assist in the contact tracing and quarantine of people with symptoms of the NCOV. Thanks for watching.